Welcome back. Time now for Real Men Wear Gowns, our campaign to get guys to pay attention to our health. Make the appointment, put the gown on, get screened, be proactive. One of the most serious but sometimes overlooked issues is lung cancer. And joining us now is Dr. Maish, a thoracic surgeon with Franciscan Health. Thank you so much for being here.
Thanks for having me.
So lung cancer has long been associated with smoking, right? We've seen smoking rates kind of go down, but lung cancer is still an issue, particularly with men. What are you seeing?
Yes, unfortunately, men have earlier access to cigarettes, so commonly they start smoking younger. We also see that they smoke heavier. That might be some of the demands that they are thwarting off in society. And also, since they're the breadwinners in the family, they often have more funds to be able to fund the habit. So we do see a higher proportion of lung cancer in men as a result, although women fall not too far behind in this day and age. It's kind of evening out over the last 2 or 3 decades.
What are some of the early warning signs that we should be watching for?
Unfortunately, lung cancer can get pretty far advanced before we actually have any symptoms. Kind of common early signs people would notice, for instance, that perhaps even though they've been able to actively participate in sports or maybe keep up with their kids or their colleagues, now they're just noticing that they're a notch behind, even at the same rank and file, so to speak. So most people will notice maybe a little bit of a cough, sometimes feeling fatigued. As things get more advanced, even chest pain or sometimes even coughing up some blood.
So I would imagine, and I've heard a lot about screening recently, that would have to be a great idea.
Screening in lung cancer, fortunately, is very easy to do. It doesn't require, drinking a lot of substances to clean yourself out. It doesn't even require any anesthetic. Just going for a CAT scan, which is just a simple test, no IV, nothing. You just lie on a table, you go through this short little tunnel, and then you come out with results. Anybody who's smoking now has access or has smoking history will have access to a lung cancer screening program. This will be paid for by insurance, actually. So we really encourage people to get out and get themselves screened.
Finally, doctor, what's your message to men in particular as it relates to lung cancer?
I think that men tend to not want to talk about the things that are going on in their bodies. They're all sort of withdrawn, thinking that it's not very manly to be sick. It's very important to talk about that, especially with your physician, but even with your spouse or your friends when you're not feeling well. And also just being proactive about your own health as opposed to waiting for your wife to kind of nudge you to become proactive about it. And then once you do know that you have something that's going on like lung cancer, seek out good treatment with people that can understand how you're feeling and make sure that you can carry it out to the end.
Okay. Dr. Maish with Franciscan Health, thank you so much for being here. Really
Thanks for having me. Appreciate it.
And we're going to continue our conversation online. You can check out the extended conversation with Dr. Maish at WTHR.com/realmenweargowns. Hope to see you there.
All right, at 4:48 today, proof positive you don't have to have a hot